All right, so we're going to look at appendicular skeleton, the lower limbs, and a lot of this will just be kind of pointing them out, but there are definitely some things that I would like to show you and discuss on here as well. So this is the list. It is a little bit shorter than the first. I kind of like to give you the longer, harder stuff first, so then when you see the rest, you're like, oh, well, this part's going to be easy, all right? Plus, sometimes that's just the way it works out. So this is the list of bones and structures to know on here. We're going to start with the femur, and you can see there's a long list of features here to know on the femur. And remember, these are important because these serve as points of attachment for ligaments and muscles, points where we have articulations occur, things like that that are very important for things like learning muscles and how joints are affected, where joints are located, and just serving as those landmarks for our map of the body. And this is where the ligamentum teres actually resides. It's one of the larger ligaments that connects the femoral head to the pelvis. We also call it the round ligament, or even the ligament capitis femoris. And so this is an important site here. So here we have the head, and these are bilateral structures. You have a right and left femur. Do please pay attention to orientation as you are looking at these. And you can see this is the anterior view, and I know my little screen here is covering it up, but this is the posterior view. So you want to look and see, is the head pointed towards the right or the left, and know what view you are looking at. That is really so important when we're talking about this, and especially when we're doing this online and can't really get our hands on it. I may try to see if we can find some time to let y'all come in. We're just going to have to see how that works out. If you would like to come in and get your hands on some of these things, send me an email, and I'll see what I can get done, okay? Next, we have the neck, and I see I used the same picture here, but where's the neck? The neck is always below the head, okay? So it's highlighted there in green on the anterior and posterior view. And now, so this would not be the right and left femur. I may have misled you on the other slide when I said we have a right and left. That is one side, right? So that is anterior, and so the posterior side of the same bone, all right? Which I'm not going to ask you, is this the right or is this the left? But you do need to be able to pay attention to how they're oriented and know what side of the bone you are looking at. All right, so here we've got the greater trochanter and the lesser trochanter. Trochanter means runner, and so greater, of course, means larger. So we have the bigger runner and the smaller runner. And these names really make sense if you know what muscles attach here. Gluteus minimus, gluteus medius, piriformis, obturator, internus, and gemelli. These all attach in some way to the greater trochanter. And of course, you don't know muscles yet, but I'm sure when you hear gluteus, you realize that that is going to be associated with running, okay? The lesser is going to be where the psoas major and the iliacus, and these two muscles help to form part of your core body muscles, and they're attached and elongated and go through with movement as well. And so that's kind of where those names came from, which is kind of a neat name, I think, a bigger runner and smaller runner. Next, we have the glutealtuberosity. It is kind of hard to see in pictures, but you can tell a little bit over here that you can kind of see the Linea Aspera down there, and that it's a little more tubular up here. But this picture from APR really, really helps, in my opinion, for you to be able to see it without being able to put your hands on it. And this is the gluteal. What does that name come from? Well, this is, of course, where part of the gluteus maximus attaches. So here we have the Linea Aspera, and that literally means rough line. And you can kind of see it pretty well, I think, in the picture on the left, but the APR highlight really does help as well. It's an important insertion point for adductors and the lateral and medial intermuscular septa. And that's what divides the thigh into the three compartments. And if you think of somebody that's really got, I'm trying to think of the appropriate terminology, but if their muscles are really well developed and you can see them really well, you can recognize how you've got some different muscles in there as a compartment. All right, so next we have the medial epicondyle, and then we will look at the lateral epicondyle as well. Medial means, of course, towards the midline of the body, and then condyle or epicondyle. Well, condyle means knuckle, and epicondyle, remember, epi means above, and so it means knuckle end, or side knuckle end if it's lateral, okay? So middle knuckle end for medial, side knuckle end for lateral. Again, really pay attention to your orientation here. If you don't pay attention to which way this is facing, you'll get your medial and your lateral messed up, okay? So pay close attention to that, all right? And think about how these bones fit into your body, all right? And this is going to form your ball and socket joint, correct? So which way is this head here going to have to fit into the acetabulum of your pelvis there, all right? So that will help you to stop and think and not just memorize it. Think about that. Which way does that have to go in order to work, all right? And so if I'm looking at this one, and I'm looking at, well, actually, let me erase this here. If I am looking at this one, and this is the front view, all right, and then of course you also have to take and rotate that for your patient perspective. Which leg is that and which way is it fitting in? That's what you need to ask yourself every time, so you can make sure that you are getting these correct. Or you can just say the medial epicondyle is on the same side as the ball. That might simplify it, actually. Same side as the ball or the head of the femur. So you can always remember that is the medial towards the midline of the body is the way that it's pointing in, which makes sense. If you can rotate your view around and think about it, that's the way it's got to fit into the body. So I realized I skipped a picture here. So remember the lateral epicondyle from the last slide here is going to be on the opposite side of the head or ball and socket of the femur, all right? And so now these are the condyles, and if that was epi, so these are below, and so these are the middle knuckle is what the name means, or side knuckle is what the name means. And you can see this really does kind of look like a knuckle, okay? And again, pay attention to what side of the femur you are looking at. I have got the head or ball and socket, and so medial will be on the same side as that. Lateral will be on the opposite side as that. All right, so I really like this picture here because it highlights everything in a different color, and you can kind of associate it with your epicondyles and your condyles. So inter means between, condyle means knuckle, and fossa is a depression or a ditch. So intercondylar fossa literally means between knuckle ditch. All right, so that's a pretty easy to remember term as far as what it means, right? So you know that it's a ditch between the two condyles. So easy to find, but you need to practice the spelling. I went pretty easy on the spelling on your first exam. You need to be really, really close, guys, okay? So practice writing that a few times, because that's one of the harder parts, is pulling the words up from your brain and when you see the structure. All right, so here's the tibia, one of the two bones in our lower leg. I'll tell you how I remember the difference between the tibia and the fibula, and it's real easy to say fibula wrong. I tend to want to say tibia and fibia, but it's fibula, so be careful with that. And I just think that the fibula lies and says that he's big and he's really small. So that's how I remember it. Find a way that helps you remember which one is which, okay? All right, so here's one of the first features here we are looking at. Actually, there's a few of these. We've got lateral eminence, medial eminence here on the spine. And then in between those is what we are trying to look at, and that is the intercondylar eminence, okay? And so this is like two little heels or two little knuckles or condyles. So we're looking at the intercondylar eminence, and so we are looking at the raised portion, and it's highlighted best here in green. So it is a raised portion. All right, and so here's the medial condyle and the lateral condyle, and again, these are knuckle-like. They're not as knuckle-like as on the femur, but they are still these raised kind of portions here on the head of the tibia. And so, of course, medial is towards the midline of the body. Lateral is going to be towards the side or outside. And again, pay attention to the way the bone is rotated. For the tibia, what you want to look at to see what the orientation is the medial down here at the bottom. Which side is that on? And that will help you to orient it. This is an anterior perspective. So this is anterior. So if you are looking at the bone from the anterior perspective, the medial malleolus is on the right. All right, so we have the tibial tuberosity next. Again, sometimes in these pictures, it's a little hard to see. You can tell there is something coming out there. The APR image does show it a little better. It's a prominent feature. This one, it doesn't look as much as tube-like up here as it really does right here. And so it's kind of starting this line going down the side there. But it is a tuberosity. All right, so here we have the anterior crest, and it is highlighted in green here. And it's harder to see here, but if you look really closely, you can see a raised portion there. And this is where some of the deep fascia are attached at. You can see them to the left here, connecting the two bones together. All right, so medial malleolus. This means little hammer. Medial means towards the middle. So little hammer towards the middle. Didn't look too much like a hammer to me, but somebody apparently thought it did. And so, like I said, this is a really good thing to orient if you're looking at the anterior or posterior side. So pay attention to that. The deltoid ligament of the ankle attaches here. Next is the fibula. This is the smaller bone, and we got a couple features we're going to look at here. So here's the head of the fibula. You can see it rests just a little posterior to the tibia. It also has a malleolus, but this is a lateral malleolus, and this is again another way to orient yourself and see what position you are looking from, and this is anterior. So if the lateral malleolus, which is to the outside, is on the left, you are looking at the anterior portion, and you can see this is part of what forms what we generally call our ankle bone. So next we're going to look at the foot and all of the different portions of the foot. We are not going to learn the names of all the small, tiny bones in the foot and the hand. You will see those, but that's one of the places I tried to cut some of this material down for you guys. All right, so tarsals 1 through 5 are 7 irregularly shaped bones. Tarsal means ankle bone, all right? And so this includes the calcaneus. So we will look at the calcaneus, and there's a feature on there, but it includes that navicular, cuboid, and 3 what we call cuneiform bones. That's, excuse me, all of these here, and these are the really small ones that we're not going to necessarily learn the individual names of. So metatarsal means bones after the ankle, and I want you to be really careful with metatarsal. And we're going to look at something similar on the hand as well. It's going to be the metacarpals, because it is real easy to mistake this as part of the fingers or toes, or what we call phalanges. So you've got to remember the first long set. This, and the line could be, I guess, go down a little more like that. But this here is not separated out individually part of the toes, okay? It's this part of your hand, all right, and the front part of your feet, and you can see those ligaments in those. So just be careful with that. I see those often, they can get mislabeled. Here is the calcaneus. So we do learn the name of that one in that whole little set. And this one, though, is pretty easy to remember because this is generally what we are thinking of as our heel. And then you can see we have a tuberosity-like feature over here, and that is the calcaneal tuberosity. So here we have the phalanges, and we're going to look also at the distal phalanges. So phalanges are what we consider our fingers and toes. I want you to pay close attention to the fact, though, that the thumb and the big toe do not have 3 segments here. The others do. All right, and then so we name those. And so I want you to think about right here, what is this? Okay, those are the metatarsals, right? And so phalanges go above. And so on the big toe, you have a proximal. Remember, proximal is nearest to the point of attachment. That is here, and then highlighted in green is the distal, okay? And so the others, we have proximal, medial, and distal. And then flanks is the word that we use when it's single. So this is going to be the middle phalanx or medial phalanges, and remember the big toe does not have medial phalanges. And of course here are the proximal phalanges, and this is all repeated for the hands as well.